Most people don't realize this, but a liver bleed is one of the rarest yet most dangerous complications we see in liver disease and cancer. Now, before I explain more, let me be very clear. This is very rare. In fact, in my 15 years of surgical practice, I have seen only one case where this actually happened. So this isn't to scare you, it's simply to keep you informed. Liver is a highly vascularized organ, meaning it has a massive blood supply. So when it bleeds, especially due to tumor rupture or trauma, it can be rapid, severe, and life-threatening. What causes a liver bleed? Sometimes a liver tumor ruptures like a hepatocellular carcinoma. Other times it can be following a trauma, a biopsy-related injury, or bleeding disorders in patients with cirrhosis. And in rare cases, even a benign lesion like an adenoma can bleed if it is large and unstable. What are the signs? Sudden intense abdominal pain, drop in blood pressure, rapid heart rate, signs of internal shock. What do we do in such situations? First, we stabilize the patient with IV fluids, blood transfusion, monitoring in the ICU setting. Then, depending on the source, an emergency angiography can block the bleeding vessel. If needed, an emergency surgery can be performed to control the bleed or remove the source. And in patients where the tumor has ruptured, we often plan a formal resection once the patient is stabilized. Again, this is an exceptionally rare event, but when it happens, every minute counts. If you or your loved one has a liver disease or a tumor, don't just ignore sudden abdominal pain or signs of internal bleeding. Most people will never face this, but the few who do, awareness can save lives.